Today on Investigate TV Plus Weekend, investigations into accusations of neglect and abuse of people with disabilities kept secret, and calls for increased transparency.
When this involves my child, why wouldn't I be able to see it? Was there really an investigation? Did you ask more than one or two questions?
Plus, nursing homes in crisis, families desperate for quality care. We explore a controversial government plan aimed at fixing the problem.
The result of all of the short staffing is that people's health is not what it should be.
Investigate TV Plus Weekend starts right now. Hello and welcome to Investigate TV Plus Weekend. I'm Lee Zurich. Investigations into the abuse of people with developmental disabilities are sometimes kept secret, even from the families of the people who have been hurt. And for those who suffer and can't communicate, the unknowns are alarming. Reporter Carice Jackman explores the secret of oversight of group homes, shared places meant to have the feel of home, but with round-the-clock care.
Ashley is obsessed with Taylor Swift. She loves Frozen. She loves the dogs. She loves going for walks. The fact that everything she's been through and she still loves people so much is amazing.
You still see her personality shine despite everything.
Yes, she's a real, I really look up to her in that way.
For Brittany Bur, having her little sister, 39-year-old Ashley, home is both a relief and a heartbreak. A relief to be by her side.
We can see her and we can oversee her care.
A heartbreak because Brittany and their mother Cynthia feel they had no choice but to bring Ashley home. Have you given up on the system?
Have I given up on the system? Yes, because there is no chain of command. There is no place to go to really answer your questions.
Ashley is nonverbal and has been since birth.
Can't sit, walk, talk, has a very, very limited language.
Because of her conditions, she needs 24/7 care. But to her family, finding that care has sometimes felt more like a nightmare. They say over the years there have been mysterious injuries, unexplained bruising, and medical emergencies, with little to no explanation from multiple facilities entrusted with Ashley's well-being. After several years of bouncing from facility to facility, Cynthia placed Ashley in a New Jersey group home for people with developmental and intellectual disabilities just days before the pandemic began in 2020.
Caretakers kept saying, oh, she's just tired, she's tired. And we knew that it was something much more concerning.
Then, the family says they believe Ashley was given far too much sodium, which posed a threat to her life due to her medical conditions. The group home sent Ashley to the hospital in a medical transport van, with Brittany and Cynthia following behind.
The nurses couldn't believe her overall mental status.
Our national investigative team reached out to the group home for answers. They told us that the matter was investigated by the state, and none of the allegations of neglect made by Cynthia and Brittany were substantiated. But the family says they have no idea about the specifics of the investigation.
I feel hopeless. I feel helpless. I feel like the state of New Jersey has failed my child so miserably that I don't want to stay here.
In an email exchange provided by the family, a representative of the State Division of Developmental Disabilities informed Cynthia that incident reports are confidential documents that can only be released with a judicial order. As a mother, Cynthia believes she has a right to know the outcome of her daughter's investigation.
When this involves my child, why wouldn't I be able to see it? Was there really an investigation? Did you ask more than one or two questions?
Brittany and Cynthia say they not only want accountability, they want transparency, a better system for addressing staffers with histories of complaints, and above all, they want empathy.
You feel defeated. Every little thing is a battle. And you feel very alone.
But they're not alone. In 2018, the Office of Inspector General for the U.S. Department of Health and Human Services partnered with other government agencies to investigate cases of abuse and neglect for people living in group homes nationwide. A series of audits found that people often experience serious injuries and medical conditions that resulted in emergency room visits. They also found that up to 99% of these critical incidents were not reported to the appropriate law enforcement or state agency. The Center for Medicare and Medicaid Services, or CMS, recommended a series of practices for some states to follow to help improve their critical incident reporting, including creating registries that list direct service providers who have been identified as the perpetrator in substantiated incidents of abuse, neglect, or exploitation.
We wanted to know what these registries look like, so our national investigative team contacted every state to determine which ones maintain a registry for workers accused of abuse or neglect. As of mid-January, of the 29 states that responded, 23 have abuse registries, but only 6 told us they're available to the public. For example, Ohio's registry contains names, abuse types, and criminal outcomes, while states like New Mexico and New Jersey keep their registries confidential. Others lack registries altogether, ignoring the recommendations by federal watchdogs.
Well, who are we protecting?
It should be public everywhere, and it should be uniform across the nation.
I think that's one of the most important things.
Paul Aronson is the New Jersey Ombudsman for individuals with intellectual or developmental disabilities and their families.
A lot of the reports that are done about allegations of abuse and neglect are confidential. Oftentimes the family can't even access them. To me, that's such a missed opportunity because aside from the fact that the family deserves to know what happened and what didn't happen, they could be very useful educational tools.
Aronson has known Ashley's family for several years and has stood by dozens of families like hers. Families who also feel their cases go unheard or ignored. In his most recent report, Aronson identified 6 of the most challenging issues impacting those with developmental disabilities, with abuse and neglect at the top of the list. Aronson's report also found that a major part of the problem with abuse and neglect in group homes stems from staffing shortages.
The direct support professionals that help ensure that an individual lives a good, safe, full life in the community, but we don't pay them enough. We know that if we pay these professionals a professional living wage, we can hold them to higher standards, and we're not going to have as much abuse and neglect in the system. We just won't.
Our national investigative team combed through dozens of group home job openings nationwide to see what the general qualifications are for a direct care worker. One ad in North Carolina required candidates to have personal care dementia experience and at least 3 years experience working with people with developmental disabilities, only paying $14 to $15 an hour, part-time. Another ad for a job in New Hampshire offers up to $20 an hour. Applicants need only a high school diploma or GED. No other experience is necessary.
Setting the individuals, setting the system up for failure.
Even with Ashley now home, Brittany and her mother have struggled to find qualified workers, a challenge they say remains a constant issue.
And so in the month that she's been home, we've lost 2 caretakers.
For now, they'll continue taking care of Ashley at home, taking her on walks and keeping her in plain sight, while they continue to try to get answers from the state and fight for better care and transparency for all families.
Our team reached out to the state's Division of Developmental Disabilities, or DDD. They declined a request for an on-camera interview, saying they don't comment on individual cases, but that all allegations are taken seriously and investigated. Following our inquiries, the state has reached out to Ashley's family to review files from the 2020 investigation, a step they hadn't taken before.
They put her through so much hell.
Coming up, how a staffing crisis is hurting nursing home residents and why families say enough is enough. More than 1 million people receive care at nursing homes each year, but 77% of facilities face staffing shortages, according to a recent American Healthcare Association report. That report prompted the U.S. government to implement the biggest change to federal regulations in 3 decades. Advocates say it will improve care, but the long-term care industry doubts facilities will be able to meet what one group calls an impossible mandate. Heather Graff explores the plan that aims to solve the shortage.
She was beautiful. Her house was perfect, not a thing out of place. And food for days. She would cook days in advance for her family.
For Mary Ellen Cross, being a grandma was everything.
It was mostly about grandkids for her.
And with 13 of them, it was practically a full-time job.
School sports, dances, recitals, anything like that. She loved it.
But Karen Lambert says for her mother, that time was cut short.
They put her through so much hell, especially the last week of her life.
Mary Ellen was living at Mount Lebanon Rehabilitation and Wellness Center in Pennsylvania when she died in March 2022. She had been there less than a year, during which Karen says her mother fell dozens of times, sometimes requiring hospital treatment.
She would fall, she would get bruises, she would have cuts on her. No one was watching her.
Karen says transferring Mary Ellen from the Mount Lebanon facility wasn't an option, as no other nursing homes in the area had openings.
How do you think the staffing levels impacted the quality of care there?
Terrible. There was not enough help.
She's now filed a lawsuit against the nursing home alleging negligence.
If they would have had more help, if they would have done the things they were supposed to do, she would not have fallen as much, hitting her head. How many times can you hit your head?
When we reached out, an attorney for Mount Lebanon declined to comment, but in a legal filing, the facility denied some of Lambert's allegations and didn't respond to others. The nursing home is now under new ownership. Even so, experts say this is a problem that stretches well beyond that facility alone.
What are some of the ways that patients are impacted by challenges such as staffing shortages?
It's a huge impact.
Lori Smetanka is the executive director of Consumer Voice, a national nonprofit that advocates for the rights of long-term care residents.
The result of all of the short staffing is that people's health is not what it should be. They're declining in terms of their ability to function, in terms of the outcomes that they have, and their quality of life is diminished.
In an effort to fight that decline in care and quality of life for nursing home residents, the federal government has implemented the first ever nationwide staffing minimum for facilities participating in Medicare and Medicaid. It was finalized in April 2024 and includes more than 15,000 homes.
This is really the first major change that we've seen in a very long time, and it's really an important one.
The regulation requires nursing homes to provide each resident with nearly 3.5 hours of care per day at a minimum, and have a registered nurse on site at all times. That means thousands of additional caregivers will need to be hired at facilities across the country because prior to this new mandate, federal law only required they have sufficient staffing.
Do you believe it will improve care?
Absolutely.
Though most states already had their own minimum staffing standards, Smetanka says the majority of those fall far short of the new regulation.
The more staff that are available and providing care to residents and facilities makes an enormous difference.
But American Healthcare Association CEO Cliff Porter says it's too strict.
Can nursing homes meet these new federal requirements for minimum staff levels?
Yeah, unequivocally no.
His organization, which represents thousands of long-term care facilities, reports that more than 700 nursing homes have closed since the start of the pandemic. Porter says the mandate could lead to even more.
We don't have enough staff now. And if you make a requirement to hire more than what currently exists and no plan to help address supply, then I call that a recipe for failure.
To help long-term care facilities achieve compliance, the final rule provides a staggered time frame that will take years to fully implement. It also offers exemptions based on workforce unavailability and other factors.
Will that help ease the transition at all for facilities?
Well, I mean, on the surface, it would appear that way, but the structural workforce shortage has existed for decades. So to think that we're going to automatically somehow resolve this structural deficit in 2 years is not a realistic expectation.
Even so, Porter acknowledges the problem with staffing needs to be addressed.
These are very vulnerable people and folks that need care, and there has to be a system that has accountability to ensure that providers and operators are doing that.
Smetanka says there's a simple way to improve recruitment and secure the employees needed to care for hundreds of thousands of older Americans.
They need to be paid more. They need better training and better supervision, and they need to be supported so that they also are not only being able to take care of themselves and their families, but then translate that into better care for the residents that they're responsible for.
Back in Pennsylvania, Karen says she will continue to seek justice for her mother.
She should be here with her grandchildren, with her great-grandchildren.
And a better tomorrow for so many others like her.
No person should ever have to go through what she went through. She did not die with dignity.
While patient advocate groups call the mandate a first step, it's facing legal pushback. In May 2024, the American Healthcare Association and others sued CMS, claiming it exceeded its authority. Later, 20 states joined the lawsuit, with one attorney general calling the rule an attack on senior care. Non-compliant facilities could face penalties, payment denials, or contract termination.
We need to get help before he hurt somebody or he hurt himself.
Up next, a mother's desperate call for help goes unanswered, ending in tragedy. We investigate the struggle of a program meant to save lives, but overwhelmed by demand. Cities across America are struggling to meet the growing demand for crisis response teams, leaving families desperately waiting for specialized help that often never arrives. As the demand for mental health intervention grows, reporter Jeremy Finley in Nashville investigates why a promising new partnership between mental health clinicians and law enforcement is falling short, and hears from one family whose repeated pleas for help went unanswered, leading to a tragic loss.
Ma'am, I got the police on the line. Go ahead.
I'm not a psychiatrist. I can't. Somebody has got to get this boy some help.
Kim Lively is at the desperation point.
Something is wrong with him.
It's October 23rd, 2022. For the fourth time in 2 months, her call to Davidson County's crisis line is transferred to 911. Her mentally ill son, Triandis Farmer Jr., is acting dangerously paranoid.
We need to get help before he hurt somebody or he hurt himself.
In the calls, she asks for mental health clinicians, the same people featured in the Partners in Care program, citizen mental health experts placed in squad cars with Metro Police.
Are you guys coming with the mobile crisis, or are you just coming?
Yeah, I can have somebody come by and check on them.
The crisis people told us that every time we call, oh, we're coming out. They never came with the police, not one time.
Listen, with farmers spiraling, even the workers at the crisis line ask dispatchers specifically for CIT officers, meaning officers trained in mental health, or the Partners in Care teams.
I'm with the Davidson County Mobile Crisis Team. What we would ideally like to see happen is for our CIT, our North CIT folks, be involved in this.
911 records show dispatchers looked for the specially trained officers or the teams, but none were available. Only police officers without the training responded to farmers' crisis.
We were just trying, so hard. And me personally, I knew something was gonna happen. And I knew that if they didn't help him, that he was gonna die, and he did.
Instead of being evaluated by a mental health expert, Farmer was arrested and taken to jail. He was eventually released. Not long after, he walked into traffic and died.
He's young. He didn't even get to have a life.
Following Farmer's death, WSMV4 Investigates requested responses from the Partners in Care program. 911 records show Partners in Care were requested in 7,439 calls. They responded only 3,422 times, less than half.
I felt like if the crisis people could have come, talked to them, it would have been better.
There's a great mental health crisis in our country.
Michael Randolph helped develop the Partners in Care program.
I'm wondering what the message is for the people of the city. When they call and they can't get a Partners in Care team, what are they supposed to do?
We're going to look at the data when the calls are coming in, look at what calls we're missing, where do we need to expand next? It's always a data-forward approach.
Make sure that he's breathing.
At the city's 911 center, calls for the specialized teams and officers simply outnumber how many trained mental health responders are available.
We recognize there's a problem. What I would, instead of saying, man, half don't get it, what I would celebrate is the 50% that do, that 2 years ago would have only received an officer with no mental health clinician.
But the Farmer family isn't celebrating. They're mourning the loss of their son.
Mental health does not mean a crime. That means you need help.
Think you've hit the unemployment jackpot? That extra cash could come with a costly catch. We reveal why you might owe it all back next. Losing a job can be tough, so if you notice you're getting more unemployment money than expected, you might think it's a blessing. But as reporter Rachel DePompa explains in this week's Watching Your Wallet, that extra cash could be a costly mistake.
If you lose your job and are able to collect unemployment benefits, keep track of how much money you're receiving. The amount you can collect weekly usually depends on how much you were making when you were employed. And Sarah Foster with Bankrate says sometimes the state accidentally pays out too much money. It's called an overpayment.
That's when the state will send you a check that's even larger than what you were supposed to get. And a lot of Americans might think, this is just a gift, divine intervention. A lot of Americans really need this money when they're losing their positions. But unfortunately, Uncle Sam will come back requesting this money, and it's going to be costly if you don't figure it out.
Foster says make sure you stay in contact with your state's unemployment office and know the rules. If your state overpays your unemployment insurance benefits, you'll typically need to repay the money by a set due date.
If you realize that you are getting more money than you probably should be in your weekly checks, you can either apply for an unemployment, overpayment waiver. You can also pursue an option that helps you maybe, split up these payments because Uncle Sam will want this money back.
So again, Foster says file an appeal or request an overpayment waiver, and you may be able to negotiate a payment plan to make the balance owed more manageable if you're unable to pay in full.
And that's it for us. Thanks for joining us here on Investigate TV Plus Weekend.